Many people identify as transsexual, but they don't want to take hormones for whatever reason. They don't want to, maybe medically they can't, they don't want the changes to their body, like the body's, and they're okay with them the way they are. So we sometimes call them no-hos. There's hos and no-hos. So hos take hormones and no-hos don't take hormones. But are they transsexual because they don't physically transition? Of course they are, because it's about what's up in here. It's not the steps, like it's not the body. It defines whether it's not someone's gender identity, especially trans. So it's what they know. So if you medically transition, hormones is the first thing you would do. So male to female start on estrogen. And depending on the doctor, sometimes a higher dose than others, some might start a lower dose, so the changes happen gradually. And FTMs, like me, start on testosterone. Now for me, because I was 50 years old when I started transitioning, yeah, I was a late bloomer there. My doctor and I agreed that I would start at a much higher dose than normally he would, so that it could happen quickly for me. Because it's like, you know, at this point I'm not changing my mind, and let's just go. Because I only have a couple years left to live, because I'm old, you know? So let's get it on. So the hormones can take from, well, for FTMs, within 6 months, some changes will start to happen, because the testosterone is much stronger. So the voice will drop, and it'll start dropping within a month, 2 months. Wow. The clitoris starts to grow. And that'll continue to grow till maybe you get about, it becomes about 2 or 3 inches, and it looks like a small penis, because that's where the penis comes from in the first place. Then muscle mass starts to build, hair starts to grow, and it'll continue to grow in places that I never realized hair could grow. Yet, and the older I get, the more hair it gets in my ears, it's going everywhere. That's part of our great hormone stuff. It takes about, for FTMs in general, 18 months to 2.5 years for all the changes to really, so you can see all the changes as far as they're going to go. For me, my face actually changed. It became a little wider. Your body weight redistributes into more male patterns. The muscle mass builds. Did I grow taller? No. Yeah, really hoping for that, you know? Because it's really going through puberty a second time, which is really amazing. So there's things that aren't going to change, but things that are. My voice dropped, and if I stop testosterone, my voice doesn't go back, okay? Facial hair starts to grow, and it takes, facial hair, for all of it to come in, it could take 3 to 5 years. And you think of somebody you know that goes through puberty, it doesn't happen in a year. Right. Kids go through puberty for years, and that's what this does. But a lot of the changes will happen pretty fast. So for me, that does none of that. I can't change that back. For male to females, the estrogen works slower. So for them, it could take 2 to 3 years. What happens? Their skin gets softer. Their body fat redistributes into a more female shape. They will have less hair on their body, but it doesn't completely go away. It will not get rid of the hair on their face. They have to have electrolysis. And do y'all know what that is? It's really painful. So they'll have to have electrolysis to remove the facial hair. They will grow breasts, and depending on, you know, their family's history, their mothers, it could be, and then how old they are, how much breast tissue they're going to grow. So a lot of them end up usually having surgery and have implants for their breasts. The sexual drive goes way down for the MTFs on estrogen. And for FTMs, they become raging idiots. Literally, their sex drive goes through the roof, especially for the first year. It's just, you see an FTM and he's just transitioning, about 3 foot space every time. You're gonna need it. Medically, it puts you in the same risk for health risks as your target sex, we call it. So for the MTFs, they become more prone to breast cancer, blood clots, everything that, like, people have birth control pills, what they have to watch for. They have to also watch out for all that stuff. For FTMs, high blood pressure, heart disease, the same kind of health risks that are generic to men. So there's the other considerations that you have to go through. So now they've started their hormones and things are looking pretty cool. If they can afford it, which is the big thing, well, the next step would be surgery. So for MTFs, this is the one side they get the better benefits. Their surgery is more common, done better, and has more choices for surgeons to do it, because they've been doing it for many, many, many more years than they've done the FTM surgery. So the lower surgery, for them, they can actually, what they do is, see the guys are going to squirm in the room, but they take the penis, they remove the scrotum, take the penis, they cut it, they take out all the inside, and they cut a hole up in the middle, and they take the outer lining and they push it up inside and create a vaginal cavity. And then they take all the tissue and they actually can create the clitoris, they create the labia. I mean, it's amazing. And they're so good at it that that woman could go to see a doctor, and unless he did an internal exam, would not know that they weren't born female. That's how good they are at it. It's about $25,000 to $35,000. Very few companies, but it's growing now, are starting to pay for transgender surgeries. But up until now, it was never covered by any insurance company ever, so you pay out of pocket. So that's a lot of money to save. So very few women could actually have that kind of surgery. They also will get breast implants done. It's about $5,000. And a lot of them, if they can afford it, will go through facial feminization surgery, which could be anything from a nose job, or have their jawbones like shaped more feminine, less square, their cheekbones redone. They can do a full facial feminization, which is, I know 2 people who had it done, and it costs around $100,000 if you have everything. Yeah. And they actually cut here, they peel the whole face down. She does this. I love watching people like that. And they just cut the bones and reshape the face, and then they put it all back on and they sew it. And voila, new face. But it's very, very, very expensive and very painful. Very, very, very aware of people not wanting to lose that feeling. So they're really careful with the nerves, and now the microsurgery is so good. They get all the nerves intact, and they have orgasms. I mean, it's all there. I mean, some people, it fails. For some reason, the nerve might not regenerate, but it's pretty rare nowadays that that happens. So yes, they have full feeling.
Well, the male and female orgasm are already so different that it's
multiple of females.
Yeah, if you transitioned either way, would your orgasm still be like it was before, or can they actually do the surgery so you can feel the other?
No, it pretty much stays the way it was, yeah. FTM surgeries, usually what they have done first is the chest reconstruction, which is male masculinization. It's a mastectomy, but rather than when they do a cancer one and they just have to devastate all the tissue, they just cut out all the breast tissue, they pull the skin down tight, and they cut the excess skin off back together, and move the nipples out to where men have their nipples further out on their chests. Depending where you go, $5,000 to $7,000 for that one. Actually, yeah, $5,000 to $10,000. Everybody watch 90210, that cosmetic show. There's a Dr. Alter. He does a lot of the guys' surgeries, but he's at 10 grand, so it's expensive. So that's the first thing that most guys can afford, and that's usually what most of them do, because at least otherwise they have to walk around. They usually wear a binder. I don't know if you know what binders are, but they're painful and they're hot, especially here. I wore one for, I don't know, 5, 6, 7 years, and the last job I had before I had my surgery was in a warehouse here in San Diego, and I did shipping and receiving. So there was no air conditioning. So I have a binder on, and then I have a t-shirt over that, and another shirt over that, because I work with these guys that are kind of, left and ready guys, and I don't want them to see that I'm wearing a binder, so I have to hide it with another shirt. So now I'm wearing 2 shirts and a binder, and working in that condition all day long. It's not fun. And then for the next step for the guys are lucky. The testosterone does a lot of the changes that they want, and the only other thing that most guys will have, if they can afford it, would be their lower surgery. Okay, which there's two kinds. One's called the metoidioplasty, the other's called the phalloplasty. She's cringing. I haven't even started yet. Metoidioplasty, what they do, you have to have had a hysterectomy, or do it as part of it. Hysterectomies run about $25,000, in case anyone wants to know that. So what they do is they close up the vagina, they sew it up, they take the labia, and they put scrotal implants in the labia. And that's what creates the scrotum. And they get to pick their size. So they actually get to pick the size of them. And then what they do is, because the testosterone has made the clitoris into a small penis, they reroute the urethra so they can stand to pee. And it's probably about this long. And they come out and they have, it all works, and it's amazing. The problem with it is that most guys don't want a 3-inch penis for the rest of their lives. But that surgery costs about $30,000. The phalloplasty is the one most of the guys want. And what they do is they actually take skin from their arm, from here, all the way down to the muscle, and they roll it into a phallus, and they sew it on over or next to the clitoris. And they also close up the vagina. They do the same thing with the labia, make the scrotal sacs, and they sew this on, and it's bigger at first because a lot of the skin's going to die off because of lack of blood supply or whatever. And they sew it in, and they hook up all the nerves, every single one, and all the blood vessels. And when they're done, it's about a 6-inch penis, and they've done the urethra lengthening so they can stand to pee. It's amazing, absolutely amazing surgery. There's only about 7 doctors in the world that will actually do it, and they do it well. It used to have a 60% failure rate.
Wow.
60%.
What does failure entail?
It's like, for some reason, it didn't work. It died, the tissue died, they'd have to take it all off, there was infections, there was fistulas. So if you have the surgery and then they have to remove it, then you've got nothing down there. You got a blob of nothingness. It's a mess. So a lot of guys didn't do it, but they perfected it, and now it's reversed. In fact, I think the failure rate's only about 20% now. But what they do is they take skin and they actually create the phallus from other tissue, but they implant it inside you here for it to grow. And then when it comes, and then they attach it at the end. The phalloplasty, the one I described, costs between $50,000 and $100,000. So it's expensive. And with both surgeries, but more so with the FTMs, you're talking at least 2 to 3 months out of work. You're talking travel to wherever you're going. A lot of the guys go to Dr. Monstre in Belgium, who's I think the best in the world. So never mind just the cost of the surgery, but the time out of work and the travel and everything else.
And lodging and all.
Exactly. So, you know, it's difficult to get to that place where you can actually have those. But the guys that have had them, I've actually seen them in real life. They're amazing looking.